Hi, I'm Dr. Greg Doerr, and right now we're going to take a moment and actually talk with Dr. Steve Weiniger about the Safer Pain Relief series that we're doing right now, and in particular how we integrate some of these therapies that we do in our private practice into this type of mode of theory of getting us away from our opioid problem that we have in the United States right now. So, Doc, we basically are dealing with a massive problem in this country where prescription medication has really gotten out of control. It's becoming a pipeline into much more serious drug issues that are happening in this country. And the research that's coming out is showing they're less and less effective to begin with in treating these pain problems. So within manual therapy, within our conservative management for healthcare, we have four major things that we're doing, whether it be manual therapies like soft tissue manipulation, rehab, taping techniques, and topical analgesics, to name a few. But how do you integrate some of those in? Like, how do you use rehab in your office to help create a safer, pain-free environment for your patients?
That's a great question, Greg, and I'm going to spin that to the other direction, because to me the question I want to be asking is, how do I help the patient to heal? And there's two sides of healing. Part of it is the passive side, that I'm doing something for the patient, and part of it is the active side, that I'm teaching the patient how to do for themselves. And having a practice model that ties things together is, to me, the key to fighting the opioid addiction problem of take a pill to fix the problem. Engaging the patient and then empowering them, so that any rehab that I'm doing is not just come to me and do this exercise here, but get them doing an exercise that they want to do, that they can feel helps them to move better, that makes a dramatic difference in the quality of their motion, and that serves as a diagnostic for me working with them to see how well they're moving, to then know where I'm using passive therapies, be it instrument-assisted soft tissue mobilization, taping, to create motion. In terms of empowering them from a pain relief point of view, the topical that we use is BioFreeze. It works. It gets people feeling better. It gives them the relief short-term that they want right now, instead of taking an aspirin at 2 in the morning. Empowering them to self-manage rather than get into a crisis mode of needing some kind of a temporary self-help pill. In terms of a care model, connecting them in the office with what we're doing to help them with those tools back at home. If we're using a TheraBand ball or a stability trainer or a foam roll as part of their strong posture exercises, and when we're then coming back and when they're doing the exercises, rechecking them, and the subtle asymmetries of quality of movement that we see with the strong posture protocols correlates with what we saw when we took their posture pictures, and seeing changes in an objective posture picture against a grid, that you're seeing degrees of deviation of head, torso, pelvis from center point, and you can see them moving towards greater symmetry, seeing them with functionally stronger balance, objectively observable, more symmetric alignment, and more coupled overall body motion.
So you're basically empowering your patients, giving them the tools they need within your office, but empowering your patients outside of the office to continue that care and keep them pain-free without necessarily intervention.
That's the intervention, exactly, and it's not passive or active, it's both together. It's working as a partner with the patient, that they want to work with you because you're their friend, helping them to, as we put it, stand taller to live longer.
Yeah, there's no question that independence is a big part of what we need to do. Basically, the opioid problem, the pain relief, all of that aspect has been a passive modality for the allopathic profession for a long time. And unfortunately, within the conservative management, we've constantly, as you were just saying, you don't want to just keep it as a passive environment inside your office. Absolutely. You want to empower your patient actively outside of the office to maintain that safer pain environment.
And it's not just the pain management that's an issue that opioid spurs. The new guidelines from the American College of Physicians that recommended things like chiropractic instead of opioids and other NSAIDs. People that used NSAIDs regularly had a 3 times greater risk of renal carcinomas. Kidney cancer from taking an Advil is a big problem. On a going forward basis, a lot of the things that people have been using, not just opioids, but NSAIDs for pain relief, like knee pain and arthritis, have been found to not only not work, but impede and cause the actual problem that they're fixing. There was just a study that came out that looked at 6,000-year-old knees, and they found that people back in the day had less arthritis than the people now. A big problem is sedentary behavior, people sitting. So getting them up and moving, which is part of, to me, the chiropractic message, is what we're talking about. And we help them to move well by working with them to get the pain feeling better and get them exercising.
Now, there it is. I mean, that's basically about as good a material as you can get from Dr. Steve here, giving us a reason to keep our patients moving and get them as independent as we can and keeping them in a safer, pain-free environment.